Okay, everyone, so I wanted to talk about what makes me different from other chiropractors, at least in my opinion, and based on chiropractors that I have met in the profession. So most chiropractors use manipulation to treat their patients, and that's the adjusting. So cracking your neck, cracking your back, etc. When it comes to my practice and how I practice, I mostly use soft tissue and myofascial release to treat patients. The reason for that is because if I just adjust you, so if I just crack your neck and crack your back, even if I do it a lot, it's really unlikely to actually fix the problem long term. There's a good chance that you'll get some relief, but the goal that I have in practice is not just to bring you relief, it's to help you fix the problem as best I can. So fix is a strong word. For most people, fix just means make it a lot better and help that patient along to make sure that the problem doesn't come back, or at least they know how to handle it.